So basically, if we see about the venous drainage of the scalp, face, and their deep connection with cavernous sinus and triggered plexus of veins, this diagram. So here you are seeing subclavian vein majorly and their internal jugular vein. So these are two venous drainage of the face, scalp, and the deep connections. So basically, from above, in front of the face, here you see that supraorbital and supratrochlear veins are combining, then they become angular vein. Angular vein is running down and become facial vein. Facial vein then onwards become common facial vein, but stop, then move backward. Near the ear you are seeing superficial temporal vein, and this is maxillary vein. This is superficial temporal vein, this is maxillary vein, both of which combine, superficial temporal and maxillary vein combine together to form the retromandibular vein. This is retromandibular vein. What I have said, superficial temporal vein running in front of the ear, and then maxillary vein here, both of them combine, then form retromandibular vein. Retromandibular vein then running and is divided into anterior devian. This is anterior devian, this is posterior devian. Okay, this circle, this is posterior devian. Facial vein form here, and anterior devian of retromandibular vein combine to form common facial vein. This is common facial vein here. This is common facial vein. How it is formed? Facial vein and anterior devian of retromandibular vein combine together to form the common facial vein, which drain into internal jugular vein. Okay, now see here, posterior devian of what? Posterior devian of retromandibular vein plus posterior auricular vein behind the ear. This is posterior auricular vein and this is posterior devian of retromandibular vein. Both of them combine together and form external jugular vein, which drain into subclavian vein. And as far as these veins are concerned, this is cavernous sinus, and this is superior and inferior ophthalmic veins, which are draining into cavernous sinus. Cavernous sinus is then drained into here deep facial vein with joint to cavernous sinus here is drained into pterygoid plexus, which then drain into deep facial and then facial vein. So the connection of facial vein with the cavernous sinus here is with deep facial vein, emissary vein, and pterygoid venous plexus, and then cavernous sinus, and from here supra and inferior ophthalmic veins. Okay, so facial vein has two connections with the cavernous sinus. One is from superior and inferior ophthalmic vein. Here it gives is doing anastomosis, and here it is direct from deep facial vein to pterygoid venous plexus and then to cavernous sinus. This is emissary vein. So this is the overview of the venous drainage of the scalp. One main important thing is retromandibular vein. This is confusing. Again I am repeating, superficial temporal superficial temporal plus maxillary vein combined together to form the retromandibular vein. This is superficial temporal, this is maxillary vein, which combine together to form the retromandibular vein. Retromandibular vein then further is divided into anterior devian and posterior devian. Posterior devian of retromandibular vein combine with posterior auricular vein to form the external jugular vein. Anterior devian of retromandibular vein combine with facial vein to form the common facial vein. Common facial vein drain into internal jugular vein. External jugular vein drain into subclavian vein. So this is all about the venous drainage of the almost all about the venous drainage of the scalp, face, and the deep connections. Now I have given you overview. So now move toward the nerves of the superficial temporal region.